had the amazing opportunity to train here at the U of M after studying medicine abroad in Ireland. It was a steep learning curve at the beginning, just the logistics of how the hospitals work here and the expectations for a resident.
The main strengths of the internal medicine training program at the University of Manitoba, I think firstly is the clinical diversity. We don't have subspecialty wards, so on the CTU, residents look after all sorts of pathology.
I always heard whispers about how respected Manitoba residents are when they go away. And I think it all has to do with this early responsibility and senioring early in R1 and becoming a good leader and building strong foundation in our clinical skills and managing patients.
Our residents become seniors within their first year of training. They are exposed to leadership opportunities early, and this serves them well throughout their training program.
Night float also has essentially eliminated 24 to 26 hour call, which is quite fantastic. You will usually be working 9 p.m. to 9 a.m. As a junior, it will be 7 days in a row, once per block. And as a senior, you'll start this in second year. You'll do two-week blocks, both second year and third year.
The quality of the simulation that we get here is very, very high. Very high fidelity simulations, and we get the opportunity to use things like monitors and having the models react to the interventions that we do very, very quickly, so we can see the outcomes of the decisions we make and learn from them for the future.
Everybody here is super welcoming. They would love to get to know you. They would love to be your support system when you're in Manitoba. They love to be your family away from your family.
I think the size of our program is also a strength. It's large enough where we offer all subspecialty elective opportunities locally, but small enough where we get to know every single resident and can help them individually achieve their goals.
It's a big, small program. The only medical school in the province, which means that any tertiary type patient, from anywhere in the province, ends up here. Usually means that by the time they complete their training, they are quite well-rounded, and ready to take their Royal College exam.
Our program is very supportive of research. We offer up to 2 months of research elective time if residents wish to pursue this. We also support conference funding and travel funding for residents for each of their unique projects.
Winnipeg is actually a pretty great place to live. It's kind of that nice medium-sized city where you have everything you need, but it's not busy. You can get wherever you want to pretty easily. Things are very accessible. There are lots of fun things to do around. There's the forks, there are museums, there are festivals in the summer. If you like being outdoors, there are lots of places to go in Manitoba to enjoy the lake. Obviously for arts and culture, there's the Winnipeg Ballet here, and so there's lots of things to see, lots of things to do, and it's in general a nice city to live in.
So we've worked very hard to improve the diversity of our intake of students, and I think that's been very successful. We are also working to increase the diversity of faculty and staff, and most recently have established a lead or an office for EDI. And are working hard at things like implicit bias during search committees to improve our performance overall.
I think the program here gives you a lot of responsibility early. You start senioring in your first year of residency. I definitely learned a lot and improved a lot between my first and second year of residency as a result of that, and just have a lot more confidence in my abilities.
Our wellness committee is residents, and then Dr. Lindsay Torbiak leads it, having someone to talk to that provides support, and just residency, there's lots of ups and downs, and just having that consistent support.
We've got a very strong program with very strong leaders, and that really is, I think, one of the hallmarks of our medical school.